And good morning, it's Lupe, Classic Hits 92.7, 95.3, and the border country 102.9. Staying on top of your health can make all the difference. Today we're diving into why regularly scheduled visits with a primary care provider are more than just checkups. They're lifeline to better health, prevention, and even long-term savings. From making a real impact on your daily well-being to programs that help patients afford their care, including those who are uninsured, and with illnesses like the flu and COVID still making the rounds, keeping up with your health has never been more important. Joining us on the Street Beat is Michael Swope, family nurse practitioner at St. Croix Regional Family Health Center. Good morning.
Good morning. Thanks for having me, Lupe.
No problem. So how do regular visits to a primary care provider benefit ongoing health?
Oh, just like anything, you create a regular schedule, you get to know someone, you build rapport. Sometimes in the professional field that we're in, you ask questions to prompt certain responses, and it may not pop into the patient's head as to what might be an issue, but we bring up certain issues, and you can't do that unless you have a regular visit scheduled and keep up with those type of things.
So how does having a consistent provider improve a patient's life?
That's a big thing. I hear this a lot, that patients go into different appointments and, I saw someone else I'm not used to seeing, and there's always this change. So continuity of care is huge, and having a regular provider that builds trust and gives someone the opportunity to open up a little bit more than, it's a new face every time. So that's a huge thing, is seeing someone regularly.
Doctor visits can be costly. How can they save money in the long run?
Yeah, I mean, any disease progression gets worse and becomes more costly in general. Take diabetes, for instance. You have any number of medications and equipment and meters and lancets and things that you're going to need along the way. And if you can get that taken care of prior and prevent some of that progression or get on top of it, it goes without saying that you're going to save money in the long run. It's not to say that we're focused on money. Unfortunately, that's the way mainstream healthcare seems to be. But it's a no-brainer. You intervene early and you save money in the long run.
So does St. Croix Regional Family Health Center offer programs to help patients cover appointment costs?
We do. We have a couple of different programs. One of our more popular one is our sliding fee scale program that anyone is welcome to. There's different requirements, but it's based largely off income, and it saves people a lot of money. It kind of relieves that burden of, this isn't bad enough to go to the doctor because I'm going to get a bill that's gonna hit me. I would love to say we can do things for free. We can drastically improve the cost and offer people ways to deal with the financial burden so that we can be able to get them what they want. And that's St. Croix Health Center. That's one of their large missions in this community, is getting people the health care that they need, but not at the cost and the risk of financial burden that comes along with it. So we try and work with them best we can, constantly.
What about the uninsured?
Yeah, and that's the same for the uninsured as well. We have a fantastic resource personnel that works very hard to look at all the options and loopholes that might benefit them. So whether they're insured, whether they're on state insurance or private insurance, commercial, what have you, there's always some sort of benefit that they can help with, or we can help with, and we have a fantastic resource personnel, Krista, that does a great job at that.
All right. So with COVID and other illnesses still affecting communities, how do regular primary care visits help?
Yeah, and kind of as I alluded to before, it's regardless of if you're coming to see me on a same day urgent care visit, or I've got some sickness developing, or whether this is your routine, every few months or every year kind of visit, it builds rapport. I know a person, I know their ins and outs, and we build that relationship. And when something little comes up like that, we can talk about how this is going to affect you personally, as opposed to this is going to affect this type of population. So making those type of communications very personal makes people willing to to listen and to do what they can to help them. Not that I have all the answers, but we're going to work together, and this is going to be a partnership.
Nice. Many diseases show no early symptoms. What are the risks of missing checkups?
Yeah, and that's a really big one, and it's really anywhere across the nation. People, I understand that life gets busy. There's priority that takes place. I understand that. Missing checkups obviously increases risk for disease progression. Missing pertinent red flags that need to be addressed, and it's very easy to lose track of. Life does not get any less busy as it goes along, and whether you have a bunch of kids you're running around, whether you're elderly and seasoned and have difficulty with transportation, I understand that. That is one big thing that we help with. If we can identify barriers to get people to not miss routine checkups. The benefit is obviously knowing the patient and knowing what diseases need to be intervened on early, knowing what screenings need to happen. But regular checkups, if they're missed, we always try and reach out and try and reestablish and say, hey, we noticed you missed. If there's an issue, let us know, and if not, we can reschedule. Yeah.
What are some new things that are happening now?
Absolutely, yeah. So our newest service line is we're excited to have opened our optometry service line. So we have Dr. Greg Farrell, who joined us the past few months. I think he started in April, but he's been fantastic. I actually had a routine checkup with him. Couldn't be more pleased. He's accepting patients, so it's a full service line optometry, screenings, exams, problem visits, and offer glasses and eyewear and contacts and things too. So that's an exciting thing. We've that's been a limited resource in the area, so we're really excited to get that going. Some other things too. Recently, we've opened chiropractic service line too. That's been up and going for a little bit, and then there's some talk about partnering with podiatry as well. But we, along with our mental health, medical, dental. So it's an exciting thing. It seems like we just had an expansion and we're busting at the seams already. So that's exciting.
Let us know what time you guys are open and how do you make appointments and all that kind
Absolutely, yeah. So you can get online. Our website's St. Croix Regional Family Health Center.org, and all the contact information is there. I would encourage you, if you don't know, if there's any question, just pick up the phone and call. And that's 207-796-5503. And our front desk ladies, our patient service representatives are fantastic at answering questions there. But our hours are Monday. We have extended hours on a couple times a week, but Monday through Friday we're open at 7:30 for urgent care hours.
Okay.
And we do that for the first couple hours of every morning. Monday we close at 5. Tuesday we have some late hours on Tuesday and Thursdays, but Wednesday and then Friday's our short day. We do close at noon on Friday. So some difference of hours, but we try and get as much availability as we can.
So best probably to go to the website.
Yeah, website's going to be the best resource. I believe we've got a Facebook page as well. We're always posting things there to try and reach the community and offer different things for community involvement as well.
All right. Is there anything else you want to add before we go?
I don't think so. I've enjoyed it. I've been here for 2 years, and looking back, it seems I've been here for almost 10 years. It seems like just in being able to meet people, and I love the community. I love the opportunity to make a change. Our providers there work very well with community, and we try and focus on family-based priority. So we work with you best you can, but when it comes down to it, your health is important, and if you don't have that, I know this is a kind of a trite statement, but if you don't have your health, you don't have much. You can't take care of your family. You can't do your livelihood without good health. So partnering with patients to help them. That's my passion. There's a lot involved. Stop on in. We have 3 medical providers that are accepting patients, including myself. So,
all right.
Give us a call and see how we can help you.
Sounds good. Yeah. Thank you for being here.
No problem. My pleasure.
Well, Michael Swoop, family nurse practitioner at St. Croix Regional Family Health Center. And this is Lupe. You're listening to Classic Hits 92.7, 95.3, and the Border Country 102.9. Thanks for listening.